Hi, my name is Kendrick Allen. This is Compass Pointe Counseling. We're an outpatient facility outside of Atlanta, Georgia. Today I want to talk about the Sisyphus complex. Now, who is Sisyphus? Sisyphus is a Greek mythology. He was a king many, many years ago who was a corrupt king and didn't treat his people right, so the council had sentenced Sisyphus to do a meaningless task. And they call it a task of being absurd. And I want to compare that to alcohol and drug addiction relapse. And so we would look over here at what Sisyphus' task was to do was to roll a boulder up this hill. And obviously, as you can see, it's not a meaningful task because he wouldn't be able to complete the task simply because of this boulder wouldn't be able to stay up on top of the hill. Now, in terms of alcohol and drug addiction, what we would normally tell our patients is that you have enough evidence that you do have an addiction. You have enough evidence that you do have a dependency on alcohol, and every single time you drink, you're going to get the same results. But just like Sisyphus, some of the patients may want to go ahead and try this concept out a little bit. But there is one positive incentive for the alcohol and drug use. And so I'm going to put this up here at 100% of the time. Each time a patient would relapse either the drug or alcohol, they would get buzzed or get the high effect. And so that's the only incentive waiting for them once they relapse. In fact, some of you may even tell you that it's not as fun as it used to be. But as you can see with this diagram with Sisyphus, if he did get this boulder up here, it's either going to come back down or head down this way. And what's awaiting the patients after relapsing, even though they're only thinking about this high effect, what's waiting at the end of this is depression, anxiety, mood disruption, meaning increase in mood swings and mood instability, guilt, shame, regret, and self-loathing. And so the concept is, instead of doing the Sisyphus complex, have the patient come over here and think about what's waiting for them at the end of this relapse, at the end of this using, and they can come over here instead of trying this effect again and realize that the results are not going to be as positive as they thought about it. And what happens is that with every relapse, it sets the clock back in the brain. Every time there's a period of abstinence, the brain starts to heal. And once there's a relapse, the clock is turned back, so we're delaying the healing process with the patients. Thanks.